All right, can everyone see and hear me okay?
Looks great. Sounds great.
Great. Uh, all right, so hi, I'm Elizabeth McCall, and I'm here with my colleague Sean Corning. In this presentation, we'll be sharing our experience defining an evidence synthesis service at a non-health science library at Tufts University. Tufts is an R1 university with about 12,000 undergraduate and graduate students. Sean and I are based at Tisch Library, which serves our schools of arts and sciences and engineering. Our library has a mix of subject and functional librarians, but no dedicated librarian for evidence synthesis. Prior to this project, our library didn't have any established evidence synthesis services, and we were answering questions ad hoc. While we don't serve Tufts Medical School, we do serve two health-related sciences, including community health, my liaison area, and occupational therapy, one of Sean's areas. We began this project because we'd already been receiving evidence synthesis questions from these departments. From our social science liaisons, we also knew there was a growing interest in systematic and scoping reviews in many social science departments, like education and psychology. Since we had identified these needs, the next step was to figure out what experience and expertise already existed in the library. We gathered subject librarians together to discuss their experience in evidence synthesis, and we found a wide variation. Many of our librarians with less experience also expressed a desire to learn more about evidence synthesis. After speaking internally with Tisch librarians, we then explored what models already existed at other libraries. We spoke with our colleagues at Hirsch Health Sciences Library, which serves the Tufts Schools of Medicine and Nutrition and has a very well-established evidence synthesis service, as well as at Webster Library at Tufts School of Veterinary Medicine. Librarians from UMass Amherst's Evidence Synthesis Working Group also offered to speak with us for a non-Tufts perspective. In all these discussions, we were curious to hear how their models were structured. Examples we saw included tiers of consultations and co-authorship versus only co-authorship partnerships when working with faculty, as well as evidence synthesis workload distributed across all subject librarians versus a dedicated evidence synthesis librarian and working group. We also explored questions of how much work and time is it for the librarians providing these services, and how did each library communicate its offerings? And now I'll pass it to Sean.
Right. Um, yeah, thank you for starting this, Elizabeth. And I'm going to talk a little bit on kind of once we did this initial evidence, or sorry, environmental scan and investigation of the kind of current status and some other possible models. We thought about a few different factors when kind of defining what our model would look like. So because we are still supporting a relatively low number of requests for evidence synthesis, but while expecting them to grow, starting with leaving it as a pretty loose model where individual liaisons kind of can work with their departments and their researchers to whatever they're kind of comfortable with, to the extent they're comfortable with. But we wanted to put together some support structures and really focus on kind of learning and skill building and kind of creating a community of practice at Tisch Library to start building out our capacity and in this area where some of our departments are a lot more interested, are getting more interested in, especially around the social sciences. Um, and this kind of, a lot of this kind of focused on kind of balancing demand and capacity. We had a lot of people who are more interested from the staff side, including myself, in evidence synthesis and then they kind of currently had expertise or capacity. So we really kind of wanted to focus on that kind of like learning and skill building, and then increase a little bit our visibility of kind of evidence synthesis support. So if I could have the next slide. So once we kind of thought about how to define our model, we kind of had kind of some products that we kind of ended up creating. So the largest thing that we did was create some internal documentation around evidence synthesis. We put together some guidance for evidence synthesis questions, which can be used both by our small community of practice of people who have shown interest in evidence synthesis, but also for our virtual reference staff to get questions about evidence synthesis or and various review types for them to get oriented and figure out where they could reach out to us, make referrals, and where they might get started, as well as kind of put together a resource list. And we also had kind of interest of building this community of learning. We presented, actually, Elizabeth presented at a kind of recurring internal library community, which happens monthly-ish, where kind of librarians bring things to share back to our internal library community. So we did that with evidence synthesis to try to start getting people kind of thinking about evidence synthesis and where they might reach out to if they encounter these sorts of questions, and also maintain kind of a Teams channel and some kind of low-key meetings for sharing and bringing up questions when we have them, new things that we're learning, and as a place to start kind of collaboration. And in terms of kind of external outreach and awareness building, we really just updated or added some very brief language to our website. So if researchers are kind of searching for, Tisch evidence synthesis or Tisch systematic reviews, they will eventually get to us, but we're not really advertising
Sean,
it
we are
already.
at time.
Okay, so then
Sorry,
we can go
thank
to
you.
the next one. No worries. Next slide. So
Oh,
we're
no,
kind of thinking of
can you wrap up in like 10 seconds? We are done.
yes, sustaining, and then yes, we are moving things forward, and then that is going to be it for today. Thank you so much.
Thank you. Next up, we have conveniently on Canvas, creating a self-enroll evidence synthesis 101 course, and Elena.
Can you hear me all right and see my slides?
Yes.
My name is Elena Azabak, and I'm the Health Sciences and Evidence Synthesis Librarian at the University of Nevada, Reno. For context, I created this course in Canvas because I coordinate our cross-disciplinary systematic review service, and I'm the liaison to public health and psychology, and they happen to be our two biggest ES producers and requesters. And more over the years, I've gotten grad students who are coming to me with really, really basic foundational questions about, should I do a systematic review? What is a systematic review? And a lot of them are either joining teams with faculty members or they're buddying up together to work on systematic reviews together, and they just really don't know what they're doing. And so there's been this growing demand for basic education and orientation to evidence syntheses outside of formal courses where they may not be getting that instruction. And we have traditionally created Canvas modules that are available through the Canvas Commons or that we share with instructors to embed in their courses. But we started doing self-paced, self-enroll courses. So they have to be you and our users. They have to log in, but they can enroll themselves and do the course asynchronously. And I thought this was a good opportunity for doing another one of these. And so I created it during the summer of 2024, and I had several colleagues and a student worker who was actually an undergrad and was not familiar with systematic reviews at all, take a look at the course as I was developing it at various stages and got a lot of great feedback. But the challenge really was developing content that was basic enough that it was accessible to anyone, but that provided enough detail that someone could really come away understanding what these types of reviews are. And I wanted to make it general enough so that all disciplines could use it, but I really was thinking, okay, public health and psychology are probably going to be our biggest users. And I just didn't want to turn anyone away by making it too overwhelming to do. So I really had to limit myself. And so I created this content, and these were the modules in the course. So just a course overview with learning objectives, just an overview of what evidence syntheses are and the different types, kind of how long they take, what's involved, getting started on your review, which included like how to do a protocol, searching the literature. That was our biggest part of the course because, of course, being a librarian, that's what I have the most experience with and what I usually get questions about. Then a bit about screening, data extraction and reporting. And then at the end, I had a list of resources, our contact information for our service and for my information, and then a quiz that they could take. And I promoted this through various e-newsletters. We have one for grad students and for faculty. I made pitches during our Graduate Student Association workshop and orientation sessions. They have their own workshop series, so it's really great to share resources there. And then just during instruction sessions and word of mouth, and the usual library promotional venues that I'm sure a lot of you are familiar with. But what was really surprising to me is I got lower enrollment numbers in the course than I thought I would. Like it's not abysmal, but definitely a lot lower than I thought. Though the people who have done the course have really been engaged with it and completed the quiz. But I'm not really sure why. We have had a drop in attendance at our workshops in general that are not tied to a course. So I wonder if that's just part of a larger trend, and I'm curious if other people have experienced that as well. Um, but I'm trying to figure that out. Like, should I just re-advertise it, promote it in different ways? I'm still getting students coming in to consultations with me saying, actually, I really want to talk about what a systematic review is. However, it was imported into a graduate psychology course, which is an independent study course. And a lot of those students are the students who are going to be joining systematic review teams with faculty. And so that has been a success. Those students have actually come to me during consultation saying, hey, I saw and did your course and I have more questions. I'm actually going to do a project now. So that has been great. And I sort of wonder if maybe I should pull back a little bit from the self-enroll option and really start doing more of that, is approaching faculty and having them import this into their courses. However, it has served as a self-paced training option for newer librarians or librarians newer to evidence syntheses. They have been using it for that. And the module itself has been a sort of a new way to promote the service. So some faculty members who know about it and who don't necessarily need to take the course themselves have been really excited to see it and have talked to me about the service. And one big thing I'm trying to do, I'm trying to kind of brainstorm is, even though I prefer using the phrase evidence syntheses because I think it's more appropriate and more accurate, I think I might have to change it to systematic and scoping reviews in the title to make it more appealing. But yeah, so that's what I did, created a Canvas course, and thank you so much for listening. And here's my contact information. Would love to chat with you further.
Great, thank you. Next up, we have, my notes got out of hand. Becca and Sustainable SR Stats, capturing the real work month by month.
All righty. Hey, everybody. So I'm going to talk about something that sounds pretty simple in practice, but as many of us know, as we get into the nitty-gritty, it is actually surprisingly hard to capture, and that is how we measure systematic review work over time. Let's see if I can get this going. All right, so as we all know, systematic review work doesn't happen just once. It never ends, or at least it feels like it never ends. Sometimes it never feels like it kicks off the ground. So what we really wanted to know is, like, how do we track what actually matters over time? And this took me 2 years to finally get something that works for our department. Sorry, my clicker. Okay. So our existing tools, namely LibInsight, are developed or built to capture those one-time interactions. So think your consultations, instruction sessions, workshops. But as we know, systematic reviews are very much back and forth with the teams, long iterative processes, sometimes pretty messy. And what we really needed to track was that monthly effort so that our work is not becoming invisible. And I was really trying to force these forms built for those one-time interactions to work for these long-term projects, and it was getting very stressful. So collecting stats in general is pretty time-consuming especially if you're not using the right tools. And I was finding that the stats were also inconsistent, which was really causing me to have no faith in myself. And I didn't have a clear sense, which the biggest issue for me was not having a sense of what I needed to track. I was trying to track everything at the very beginning, and this became unwieldy and a wasted effort on my part. So when the work is invisible, your work is being significantly undercounted, and the library effort isn't fully represented in the departmental metrics. So when your data is incomplete, it's also not trustworthy, and you're not able to actually show your worth. So this, of course, makes the work burdensome a bit and inconsistent. Ultimately, what was happening, it was limiting our ability to make hard decisions or just decisions in general, specifically for staffing, trying to hire new systematic review librarians, sustainability and service growth opportunities. So the real challenge then, which was kind of the hit on what we were able to do to make everything successful, was figure out what do we need to capture? So what are the meaningful metrics? Not everything, what actually matters, and how do we capture all of this without burdening our librarians and their current workflows? So we built something to address that. And we used Qualtrics. So in 2024, we created as a team, mostly the Systematic Review Monthly Tracking Form. And this was created to bridge the gap of the individual librarians' work without disrupting what they use currently to track their work with evidence synthesis teams, while also balancing the departmental reporting needs. So what we really wanted to capture per librarian was active systematic review projects per month, the phases of the work per project, time spent and peer review work, as well as mediated searches and publications. And we track more as well, but this is specific to the librarian's work. So what the form looks like in practice on my end, whenever I'm gathering the stats for each librarian, this is just a glimpse of part of the form, but how many reviews have you worked on this month? Researcher information, any times that you met with a team, search development, kind of the beginning translations, running the searches in each of the databases and exporting results, updating searches, writing the methods, etc. And then the hours captured. So it's a structured form, but it is flexible. So if the librarian didn't do a lot of reviews, they wouldn't have to fill out every single section of the form. And importantly, what we wanted to know is the multiple phases of work captured per project, which really reflects that back and forth work and nature of systematic reviews. This is a version from what the librarians see when they're filling out the form. So this is mediated search work. This was another point of not contention exactly, but another thing that we were trying to decide how to track it was mixing our everyday work of expert searches versus scoping review, systematic review work. So mediated searches for our department is any search done by a librarian that could be for a researcher or a hospital staff that's not necessarily for a publication. Righty, and then same with peer review. Our team will peer review each other's searches before we send it out for translations. All right, so what makes it work? This approach
We're
works.
at time. Can you wrap it up?
Yes, this work it's meaningful metrics. It's not necessarily everything, but basically this is the work that we have always been doing. We're just able to see it and track it. So, and I'll answer questions later, but.